Hey, Polly.
Hey, Greg, how are you?
Doing all right. Doing all right.
Hey, I've got to mention that I'm feeling a little warm in here today, but I gotta leave my sweater on because we're like perfectly matching.
Look at that. That might be a new trend. Maybe we have to coordinate outfits.
Phew, I don't know how successful it'll be.
In other words, no.
I wouldn't mind. I just think it's a lot harder than coincidentally showing up with the same colors on. But it does look like we planned it.
It does.
Yeah.
This is new. Totally. This was not totally preventable.
Yeah.
We matched. But
yeah, but who we got today?
Today we're going pretty far away. Not very far, but we're going out to Tennessee.
Oh, yeah.
Yeah, we're going to Roane County, Tennessee to speak with Nathan Wray. And Nathan is a Drug Endangered Children Coordinator for the Roane County Anti-Drug Coalition.
Oh, interesting. I love talking to other coalition members.
I do too. This is going to be great. I thought it would be a great connection. I know people might be listening like, wow, we're over here in Rhode Island. And although, we are pretty national in a few different other states, but
international.
Exactly. How this correlates with us is there's nothing better than idea sharing and seeing what coalition is doing and what's working. And not only is he going to tell us about some of the great work that they're doing out there in Roane County, but he's also going to share a story, which I'm pretty sure a lot of people, no matter where you're from, are going to identify with.
All right. Can't wait to hear it.
All right. So without further ado, today joining us on the Totally Preventable podcast, we have Nathan Wray, the Drug Endangered Children, or DEC coordinator for the Roane County Coalition. How are you doing today, Nathan?
I am great. How are y'all doing?
Doing
good. Thank you. Yeah. I think we should add Tennessee in there.
Oh, yes. We did go over that.
We did, but yeah,
just get confused. But yes, the Roane County, Tennessee.
For people that weren't in the room.
Yeah, that's right. They could be thinking Virginia. So yeah.
That is right. So Nathan, to get us started, can you share with us your story?
Yeah, I'll give you the short version because there's a really long version of this. But I started smoking at 12 years old. So I'd gone to a birthday party and a girl had asked me, she had told me if I smoked a cigarette with her, that she would be my girlfriend.
Oh.
And so I was like, this is awesome. I'm going to be the king of the world at 12 years old. And I was thinking like, after we smoked the cigarette, if we're boyfriend and girlfriend, there's a kiss coming afterwards, right? So this was like my whole Super Bowl was happening in front of my face. And so we smoked the cigarette and we put it out and she said that she was just joking with me. And so I went home, single. But for me, it was like, I really believe that I was addicted to nicotine in just that one cigarette. But I got home and my mom and dad smelt the smoke on me. And so they sat me down in the living room and they grounded me for 2 weeks. Like that was it. They didn't know how to tell me like, Nathan, nicotine changes the adolescent brain, and that can be permanent. They didn't tell me, Nathan, nicotine affects the part of the brain responsible for attention, learning, and memory. And that's so important when you're a student. They didn't tell me that. They didn't tell me things like, Nathan, nicotine, tobacco products contain like acetone and arsenic and formaldehyde. Like they just didn't know how to have that conversation with me. And so after the end of that 2 weeks of being grounded, I went right back to smoking cigarettes whenever I was happy or sad or scared or mad. It didn't matter what my emotion was. I was going to use tobacco to deal with that emotion. I had no emotional regulation skills at all as a teenager. At 13 years old, I was offered marijuana for the first time. And so I thought to myself, well, if tobacco isn't hurting me right now, then what's marijuana going to do to me? And so that was my mindset. Like, this tobacco's not bad, because I didn't see the long-term effects. And so I started using marijuana at 13 years old. And that became my coping skill. That and tobacco was my coping skill. At 14 years old, a senior in high school invited me to a party And that was, I thought, the greatest thing in the world. I just wanted someone to notice me. I wanted to be popular, and I wanted to be cool. I wanted to be like just like everybody else. And so I went to the party, and I got drunk, and I went home, and my parents grounded me for 2 weeks. They didn't know how to have the conversation that, hey, Nathan, alcohol affects the part of the brain it affects the brain in the same way that tobacco can. Like it really does a number on the part of your brain responsible for attention, learning, and memory. I was a terrible student. I say I was a terrible student. I wasn't a bad student. I was just using substances, and my brain wasn't developing in the way that it should have. And I really believe that that was totally preventable. Like all that was totally preventable. If an adult would have sat down with me and said, here are the dangers of nicotine, here are the dangers of alcohol, here are the dangers of marijuana, and here is how to regulate your emotions, I think my life would have changed, my trajectory would have been a whole lot different. So my at 15 years old, I just start whatever you put in front of me. I don't care. I've got all these emotional problems, and I just didn't care. I was just going to use whatever you put in front of me, because I didn't want to feel emotions. I didn't want to be happy. I didn't want to be sad. I didn't want to be mad. I just refused to feel any type of emotion at all. By the time I get to my senior year in high school, I'm failing. I am not doing well in school. And about a week before school is out, I get kicked out of school, just because I'm not going to pass anyways. I'm not going to graduate. I'm not going to walk across the stage. I'm not going to get a diploma. I'm not going to have the graduation party. My parents aren't going to cheer in the stands for me because I'm not walking across the stage. And so I go home right when they kick me out, and after school, a friend comes over, and he asked me, like, what are you going to do? Like, what's next? And I said, well, I'm just going to get a job. Like, I guess that's my only option. And he was such a good friend. He convinced me to go to summer school to get a diploma. I can't stress that, how important that is, to get that diploma, because I don't think that I'd be where I am today if I didn't have at least a high school diploma. So I got my high school diploma in summer school. I was supposed to graduate with my friends in 1996, and my transcripts say I graduated in 1997. So I'm a 1997 Mechaniqua Brave. I went to school in Bunker Hill, Indiana. I won't ask you to spell Mechaniqua. It's very, very hard to do. But after high school, after I get my diploma, my dad gets transferred to Phoenix, Arizona, and I go to Phoenix with my mom and my dad and my brother, and I spiral further out of control. I'm drinking more alcohol, smoking more marijuana. There's a whole lot more access to marijuana in Arizona than there was in Indiana. And so I'm just spiraling further out of control. I get in trouble with some people I shouldn't be hanging around with. And my dad kind of pulls me aside one night, and, he's like, listen, if you want out of all the trouble that you're in, me and your mom are transferring to Nashville, Tennessee. If you don't want to go with us, like, this is it. Like, you're done. We're not helping you anymore. And so it took me probably a good 30 minutes to admit to myself that I needed to leave. Like, I needed to get out of Arizona, but I was lying to myself because I was convincing myself that I wasn't the problem, that it was Indiana, that it was Arizona. And that if I could just get out of Arizona, I'll be fine, right? My whole life will change. So I go to Nashville, Tennessee, and I'm doing a little bit better. My dad got me a job. I was a baggage handler at Southwest Airlines. My dad got me a job, and I met my wife at my job. And so we started dating. And when we were dating, she really didn't know what I was into, because I could go pick her up. We could go out to eat. We'd go to the movies. I could go drop her off, and then I could go do whatever I wanted to do. And she didn't have a clue. It was when we got married, she was like, oh man, what did I get
Little
into?
bait and switch.
Yeah, the whole bait and switch. She was like, I did not sign up for this. But we were married and we had a son. And when he was 3 months old, she put her foot down and told me I had to choose. I had to choose them or I had to choose the life that I was living. And I'll go back to where I told you, well, I didn't mention this, but tobacco, alcohol, marijuana, all of the substances affect the part of the brain responsible for making good decisions. I didn't make a good decision that night. So I left. I left and I went and lived in a garage for 9 months. And at the end of that 9 months, I knew that life could be better. I knew that I could be better, and I just needed to figure out how to do that. I couldn't call my dad because he was really super mad at me, rightfully so. Um, she was the only one I could call. My mom wouldn't talk to me either. She was mad at me, rightfully so. My brother wouldn't talk to me, rightfully so. She was the only one I could call. So I reached out to her and she gave me a list of things I had to accomplish. If I wanted to be back in their life, I had to accomplish a certain amount of tasks, basically. Find a therapist, find a counselor, talk to someone about the trauma that I had in my life, because that's what fueled all of it. I never dealt with the trauma that happened to me, and so I was just using as early as I could some type of substance to make myself feel better. And so after about 6 months of counseling and therapy, I was sober. I was still smoking cigarettes, but I had gone from 2.5 packs a day down to two cigarettes a day.
Wow.
Wow.
And yeah, and so I called her and I told her, I said, "Hey, I'm sober, but I'm still struggling with these cigarettes. I'm only smoking two a day, and I'm almost there." And so we started marriage counseling, and then I got to go back home, and our life hasn't been the same since. It's been an incredible journey of ups and downs, but I will say that right now we are probably in the prime of our marriage. I think that I don't know that we've ever been happier as a husband and wife.
Wow.
Yeah,
Thank
that's the short version.
Oh, thank you for sharing.
That's an awesome story.
It is. It is very uplifting.
Yeah. So you're a coordinator. We have a lot
Yeah.
of around here. But so can you tell us how you got into being a coordinator and maybe some challenges that you faced in Tennessee?
Yeah, so I was working with youth groups, um, gosh, back in 2014, 2015, and I ended up having a back injury, and I couldn't work my full-time job anymore, and so I was working with youth groups pretty much full time, but I needed a full-time job. Like I couldn't just do that all the time. I ended up having back surgery and rehabbed all that and I was looking for a full-time job after my back surgery, and I called a friend and I said, "Hey, there's a job and I really would like you to be a reference for me." And she didn't call me back. Like I left her a message and she didn't call me back, and I was like, "Oh man, maybe we're not good friends. maybe we're not as good of friends as I thought we were." She is actually on vacation and she shuts her phone off when she's on vacation. And she called me back and she goes, "Yeah, like that's great, but there's a job that I think you'd be really good at since you've been working with youth for a while." And so she introduced me to the executive director at the Roane County Anti-Drug Coalition. And I sent my resume and I interviewed, and it just fit. It was a good fit. And so that was it'll be 7 years in August. That we met and I started working the coalition. I'd say challenges, coalition work is so rewarding, and you don't want to look at the challenges and you don't want to look at the barriers. But I would say like in our community, our biggest barrier that we have is like transportation. We can do all types of events and coordinate events, but we don't have a public transportation system here. And so it's hard to get participation outside of school hours.
Mm.
And so we have to be really we got to be really creative when we do events. And sometimes we have to do the same event in like 4 different cities in our county, because we know that if we go to one city, we're not going to get the whole community
Mhm.
to come because some of them just don't have the transportation.
Mm.
So we've got to do that in multiple cities. And I'm sure there are many more challenges. I just don't like, I don't know. I see challenges, opportunities. So I don't really focus on the challenges too much. We're very lucky here because our schools are so supportive of what we do. Anytime we want to go to a school, they're like, yeah, come on in.
That's great.
Yeah, it's really awesome.
Is vaping a challenge with your youth?
Oh,
Yes.
for sure.
Want to make sure it just wasn't us up here in the north.
Yeah, yeah, you Northerners,
Yeah.
you need to get a handle on that.
Yeah.
No, yeah, so it's definitely a challenge down here, and we've made some really big strides. Our middle schools are we have, compared to last year, well, I'll just say this. In October of last year, we had 5 middle schoolers that were caught vaping, just in October.
Mm.
October of this year, seeing that trend in middle school continuing. I think November we had 2. In December we had 0 middle schoolers caught with vape. We did over the summer work with the school. We worked with juvenile probation. We worked with the health department. And we all worked together to change the school policy on what happens when a student gets caught vaping. And I think that school policy has really helped reduce the amount of students that are being caught with vapes in school. Even our high school numbers are down by about 35% this year.
Wow, that's
Yeah,
good.
which is awesome.
That is really good.
Yeah.
Now, in your title, you are a drug endangered children coordinator. Can you tell us what's a drug endangered child?
Every child.
Mm.
You want to say like it's just the kids who live in homes where their guardians are misusing substances. But honestly, it's every child. If me and my kids get in the car and we drive down the road and there's someone who's a drunk driver or who's been using opioids all day, my kids are now drug endangered because of that driver.
Mm.
Parents that are vaping and using marijuana at home and that are just leaving that stuff out to where kids can grab it and it's easily accessible. Those are drug endangered children. Every child fits into this, and so the approach of the National Alliance for Drug Endangered Children is kind of like the idea of like no child left behind, like 100% safe children. Like that's the goal, and that's what we really want to get to. But we know it's going to be very, very difficult. But there's some systems that are in place to help us get as close as we can.
So can you talk to us about like the broader impact of substance misuse and kids, and if you've got some initiatives or some ways to mitigate that?
Yeah. So in our county, in Roane County, last year we had, don't quote me on this, it was over 50 overdose deaths. We've already surpassed that this year. And so what we're seeing is most of it methamphetamine, but it will have fentanyl. They'll have fentanyl in their system. We're not seeing a whole lot of xylazine here. And we're really surprised and excited. That's a weird word to use, but or I guess more proud of the fact that our our overdose deaths here don't really have like opioid medication. It's not the medication. It's not hydrocodone or oxycodone that they're finding in the systems. It's fentanyl, and so we've done a lot of work on medication safety in our community, locking up your medication, disposing of your medication, never sharing your medication. Like we have done a lot of education around that. Our funeral homes, even like they will let people know, hey, if your mom or your dad that just passed away had medication, here's where you can dispose of it, or here's how you can lock it up in the meantime. Like we have so many partnerships in our community, because this was an issue a while ago, but we've really put some processes in that help with that. We give out free medication lock boxes at the coalition. We give out free Dispose RX, free doTERRA. We have 5 medication drop-offs in our county, and we even partner with like the assisted living homes, and we even partner with a realtor, Caldwell Banker, Jim Henry and Associates. They actually, if they have rental homes, they actually tell their rental people, hey, go by and get a drop box at the Roane County Anti-Drug Coalition, and you can install it in the home. Like it's not a big deal. So those kind of things are happening here, and among many other things. But those are just some of the things on the top of my mind. Yeah.
So when addressing the needs of drug endangered children often requires a multidisciplinary approach. Can you share examples of successful collaborations between prevention programs, law enforcement, and community organizations?
Yeah, for sure. So we just had a meeting with all first responders, with Roane County Schools, with our DCS office, our juvenile probation office, and us, to discuss and implement Handle with Care. And so Handle with Care is, let's say an officer pulls over a family, it's 10 o'clock at night, and they find drugs in the car and there's kids in the car. The officer finds out where the kids go to school, and then he scans a barcode, and that's the Handle with Care barcode, or QR code, and he just puts in, hey, Johnny and Melissa, Handle with Care, and he puts the school in, and that goes to a representative at the school. So the representative of the school comes in the morning and they see, oh man, we have a Handle with Care. And so they alert those teachers that will be interacting with Johnny and Melissa that day. And so maybe maybe Melissa's fine, but Johnny comes in and he's tired and he's sleepy and he falls asleep in class. And instead of the teacher going, hey, Johnny, no recess today, because she's aware that he had an event last night and needs to be handled with care, she'll say like, hey, Johnny, why don't you come with me? Let's go to the nurse's office, and you can lay down for a little while. And when you're ready to re-engage in class, you can come back and re-engage in class. I think the really cool thing about this collaboration was everyone, and like coalition work, sometimes people are like, that's not going to work. I'm not going to go to that meeting. Everyone that we invited showed up to this meeting and they were excited about this program. And so that's just one of that's a win for us. Like that is one of our biggest wins that we've had in we've had a lot of great wins, but that's one of the biggest ones we've had. Handle with Care is so important because we can reduce the trauma that the children are involved in like immediately. And that's where we need to be as coalitions. It's like, how can we get in early enough to reduce that trauma so that as they get older, they do not repeat the cycle?
Wow, that's a great plan.
There is.
I really like that.
That's awesome.
from the name all the way to the procedure. That is a great plan.
Yeah, love
Yeah,
that.
it's not ours. It's I'd have to look it up where it came out of. But it was first created somewhere up north, in the Northeast. I want to say like New Hampshire, maybe something like that. But it worked, like the system worked.
Mhm.
And so other people kind of caught on, and it became part of trauma-informed schools. And but we are implementing it in our county. And one of the things we're doing as a coalition too is like whoever sends the most handle with care notices, because we know like first responders get busy, right? They're not always going to have time to do that. So whoever sends the most, we're going to give them some type of reward at the end of the year or at the end of a semester. We're still trying to figure that stuff out, but we want to reward them because that's a little bit of extra work on their plate, but they're doing it for the children.
Yeah, it's
I
nice.
Yeah, I love that. And I love when coalitions are able to build off another coalition's initiative. There is no reason for us all to be reinventing the wheel.
Right.
If someone's put the time and effort in and it works, it's all to help kids. So
Mhm.
why wouldn't we want to share and let the kids benefit and try to help them out? Yeah.
Yeah, for sure.
Yeah. So I heard you talk about community organizations, and I know they're super important here. I'm guessing they're important there. We have some challenges here getting everyone to the table.
Mhm.
Do you have those same challenges, or is everyone on board?
Yeah, no, I mean, we have challenges getting everyone to the table, and it's for different reasons. Some it's timing, some it's budgets, and some it's politics, and so you just do the best that you can, and you try to think of new creative ways to get them to the table, and sometimes it's who's in the seat, right? Like, we've seen people, like a director of another organization, they've left and another one has come in and they're like, oh, I want to be involved in what you're doing. And so we're like, that's great. So always keeping the door open for a conversation is probably the most important thing you could do. And I'll be honest, like sometimes the politics of things just drives me insane. I don't like it. And sometimes it's hard for me to keep that door open because I just want to be like, forget you, like we're doing great things over here. But you want to keep that door open because you never know who's going to be sitting in that seat next and may want to be involved. And so, yeah, I mean, I don't know that there's a coalition in the United States that doesn't have that type of challenge. And if they say they don't, I don't know.
Big fat lies.
Yeah.
Yeah.
Oh.
So now, given the evolving nature of substance abuse trends, how do prevention strategies for drug endangered children adapt to new challenges in substances?
I think I don't think you adapt.
Mm.
I think you go back to the beginning of the strategic prevention framework. As drug trends change, we've got to go back and assess everything. Like we have to go back to the beginning. So I don't think you have to like change everything that you're doing, but you do need to go back and say, okay, this is something different. We need to assess what's going on, and then follow the rest of the strategic prevention framework from there. I think that's the best way to do it. I do think there are situations where you're like, yeah, that's not working, but maybe we change something in our planning. Maybe it's something with our community involvement or our implementation plan. Maybe that needs to be adjusted. But again, if you're going to adapt that, you go back to the beginning of the strategic prevention framework and say, okay, we assessed all of this. And so why isn't our implementation plan working? And so I think it's, like you said earlier, you don't have to reinvent the wheel. The wheel is already there. And when you don't use the strategic prevention framework the way that it should be used, I saw it best explained one time. It's like spokes in a bicycle wheel.
Mhm.
Like the more that you take out, the weirder that wheel turns, the more it wobbles.
Mm.
Yeah.
And so if you're not following that framework, or if you just like you get lost in trying to fix something, that strategy plan that you have in place is it's going to wobble. And until you go back to the beginning and go, you know what, let's start over. Like, let's start fresh. Let's gather our sectors. Let's bring our sectors in. Let's assess the issue. Let's communicate with one another, and then let's move forward from there. I just don't, I don't think, like, again, you have to reinvent the wheel. I think you just go back to the basics. I've always been taught that. Go back to the basics, the fundamentals. The fundamentals is what makes great athletes. Athletes who have the fundamentals down, they become some of the best athletes. Coalitions that have the fundamentals down, they become the best coalitions.
Well said.
Thank you.
We have three fairly new coordinators, so they're learning the strategic prevention framework.
Yeah.
Or we call it the SPIF, but
Yeah,
they're
Spiff
all
RX. Yep.
they're pretty silly group, and so they've been calling it the here. So I had a lot of talk lately.
That's awesome. So how new are they?
So all under a year.
Oh, wow.
Yeah, so I think the longest one has been here since maybe April. And
Oh,
then
wow.
in June or July maybe. And yeah, and one's been here just a few months. So, but it's actually nice because it's relatively all the same time. So they're kind of all learning things at the same time and working on,
Yeah.
they all have a open mind about it. It's not like someone's been here for 8 years and they do it this way and that's it. So it's kind of a blessing. So
Yeah.
it stunk before when we had no coordinator. The empty office, but
Yeah. Yeah.
no,
That's kind of how our dynamic was here. Is I came on in 2017, and I'm telling you, like, with the youth, it was sink or swim. Like, you had to figure it out quick. In my first month, I pulled off an assembly, and I was exhausted after that.
yeah.
But one of the people that came to the assembly that had a speaking part at the assembly worked for our recovery court, and she was like just sold on the kids and being involved, and so she actually came over in 2018.
Wow.
And she said, I want to be a part of what you're doing. And she talked to our executive director, Sarah Harrison. And she said, really want to do this. And do you have room for me? And Sarah said, matter of fact, we have the room for you. So come on. And me and her, like, we grew together, right? Like, we learned all of this stuff together. And it just makes for a dynamic team. So it's really awesome that you're three are learning all of this together, because that'll make for one dynamic team for sure.
Oh, I love to hear that.
They will
Yeah.
hear
I
that.
love to hear
Their
that
heads are
dynamic.
already
Yeah.
I love that.
they all pretty much hit the ground running. So
Awesome.
yeah.
Awesome.
Making all of our seem antiquated.
Yeah.
Yeah. Yeah.
Wow.
So there are so many new trends coming out.
Mhm.
So many things changing, and we are kind of held to a standard of using evidence-based policies and
Yeah.
plans. And so how do you balance that? Because sometimes there's not an evidence-based
Mhm.
program to counteract something
Can
new.
Can you explain evidence-based for me? No, I'm just kidding. Oh, yeah, how do you balance that? I think, well, the way that I do it, we use quite a few different curriculums. Um, we have Botvan Life Skills, we have Thrive Teen Resiliency, Generation RX, We have lead law enforcement against drugs and violence, and then a handful of others, and I'll forget some. So, but I think like uh, when it comes to something like, well, there's not a lot of evidence-based curriculum on underage drinking, right? Like there's not just this is your curriculum, this is where it's at. Um, we tend to like bring in real stories. And so we've got different clubs in the schools, or sometimes we'll do an assembly or even classrooms. Well, we'll bring someone in who has a real story, like Chris Sandy. Chris Sandy and Choices Matter. I don't know if you guys have ever used Choices Matter or if you've heard of them, but they have just different speakers that they come in and share their stories about maybe being hit by a drunk driver. Chris Sandy was the driver, and he had been drinking one night and drove and had actually killed an elderly couple. And so he went to prison, and so while he was in prison, he kind of started to tell his story, and I somehow the prison said, hey, if you'd like to do this outside when you get out, let us know and we'll connect you with the right people. And so now Chris Sandy travels all over the United States telling his story. And I think that's how we balance it, is when there's not curriculum, we're going to bring in someone who has the actual lived experience, because that's really hard to beat.
Mhm.
Now, they may not know, things like um, how alcohol affects the liver. They might not be able to say that, but they can definitely say like, well, my DUI cost me this much money. It cost me my job. It cost me my marriage. It cost me all of this. And it's not worth a cent. Like it's not worth any of it.
Mhm.
And so I think that's how we kind of balance that, is it's evidence-based curriculum, lived experience, and honesty, right? Like, there are so many kids that we do these quiz cards with them, and we'll say, tell me why vaping is bad. And they'll go, it causes cancer. And we go, well, to be honest with you, we just don't know that yet, right? Like, I'm pretty sure, like, I'm willing to bet my farm that it will, but we just don't have any hard data that it does right now. And they appreciate that honesty.
Right.
And so I think those three things combined really make for a great education for students.
Kids see straight through
Yes.
adults if they're not telling the truth,
Oh,
if they're not being straightforward. Yeah,
You
they
only
would
get
rather,
one shot.
right. They would rather hear like, I don't know.
Mhm.
I'll look into it and get back to you than you pretending like, so.
yeah. I think they would rather hear you say, I'll look that up and let you know,
Mhm.
than lie straight to their face. And then they're going to find out anyways.
Right.
So, and then if you've lied to their face and they find out about it, your
Okay.
credibility is out the window.
Yep.
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 Yeah, it's
Absolutely.
gone.
This has been another great interview. Thank
Yes.
you very much, Nathan.
Awesome.
I love
Awesome.
talking to other coordinators. I think it's so
Yeah.
it's my favorite thing about CADCA. When we go,
I know the networking is so great at
Yeah.
CADCA, and me not going probably was totally preventable, but I'm not great at schedule making. And that is Ashley Freeberg, our other coordinator in the office. She's the schedule queen.
so we're gonna
Um,
blame this on Ashley. Her-
well, blame it on me because I don't follow the schedule.
Well, if you change your mind and you're there, let us know and we'll go for
Yeah.
coffee or something.
Yeah, absolutely.
But-
Absolutely. Or I'll let you know if somebody goes.
Okay, yeah. Maybe we'll
Yeah.
like them as much as we like you.
Okay. All right.
Before I let you go, Nathan,
Yeah.
we were scheduling this podcast.
Yeah.
He told me, because I usually put the time and I put Eastern because I don't know where everybody is at all the time.
Yeah.
Now, you told me a fun fact about time zones. Can you just share that with us?
Yeah. So we are, Roane County is the beginning of Eastern time zone. in East Tennessee. So when you come from Nashville, you're driving towards Knoxville. When you get into Roane County, you've entered Eastern time zone. So I cannot tell you how many times, and I told this to Gregory, how many times I've missed the pickup time for my kids at school because I'll hit a cell tower that's West Tennessee
Yeah.
Central Time. And so I'm just driving around like, oh, it's only 2:00 and it's like 3, and my kids are like, where is dad? Like, it's everybody else has gone home. The buses have left. There's only one teacher here. Like, I want to go home.
Yeah.
And so I've missed it so many times, but it's very interesting because you can pick up a central cell phone tower real easy here in Roane County.
Right.
Yeah.
And no one's gotten you a watch yet? Just a regular watch?
Well, I mean, I have one,
Oh,
but
it's
it's an Apple Watch.
right. Yeah, you need
And
just
so
a regular watch. With some-
I love your directness. She was like, no one's gotten you a watch. Like, they're like the easiest thing you could ever buy.
Some people don't like that directness.
Well, it's like, your time is up, buddy.
Well, thank you so much, Nathan. This has been a great interview. We appreciate all the work that you're doing, you and your entire team.
Yes,
Please
thank
keep
you.
up that great work. Thank you.
Thank
Good to
you.
meet you.
Thanks for having me, guys. I really appreciate it. Very good to meet you.
Take care, guys.
Bye-bye.
All right. Bye.
Bye-bye.